Okay, ladies and gentlemen, welcome for this uh, video learning discussion about the continuation of Chapter 2 of the subject, the Specialized Crime Investigation 1 with Legal Medicine. So, stay connected and continue uh, absorbing knowledge regarding Chapter 2 again as far as the subject is concerned. Okay, so let us start. Uh, Last time we ended our discussion on the methods of identification, and to remind you again that in criminal investigation, identification is a very important tool or purpose that we should accomplish. And identification is a tool also when we intend to accomplish the threefold aims of criminal investigation. So these methods are very important, especially these methods that I am discussing are methods that are medico-legal in nature. Medico-legal in nature. There is the application of medical knowledge in this method of identification. So, and there are other forms, just like in criminalistics or in other forensic sciences. But in this discussion, it is more on medico-legal aspects of identification. So there are two methods. We have by comparison. You by comparison, you will be able to identify, evidence. You identify uh, the suspect. Okay, so you match evidence, available evidence and files, in order to establish and prove something. Okay, so again, comparison is deals with the uh, comparison of two similar things or evidence, while in exclusion, this is the process of elimination. For you to establish something, then you have to apply elimination. So what remains, will be uh, the proof. Okay. So as you can see here, by comparison, identification criteria recovered during investigation are compared with records available in the file. By exclusion, if two or more persons have to be identified and all but one is not yet identified, then the one whose identity has not been established may be known by the process of elimination. So, if you want to identify something, then you can compare, example, the fingerprints. There is a fingerprint recovered at the crime scene and a file fingerprint or a fingerprint recorded from the suspect. Then you compare it, you match it. If they have the same characteristics, then we can say that the suspect, or the person of interest have something to do with the crime involved. Yeah, that is by comparison. So likewise, in exclusion, if you remove all, other uh, leads, and this person is the most relevant, this person is, example, there are 10 suspects, there are 10 persons of interest, then you have to do exclusion, whoever is the suspect or person of interest have the more number of uh, leading him as the suspect, then he will be the one as the primary suspect, or vice versa. No, If there are 10 suspects, no, and you exclude those suspects or persons of interest that have lower evidence to prove their participation, then at least you could establish who is the primary suspect. Okay? So, basically, when we are identifying, there are two targets of identification. Number one is, of course, the persons. Number two, evidence, okay, or things related to the investigation. Okay? So, first, no, in the identification of persons, no, there are classification of the basis of uh, human identification. Okay, you know, uh, if you are at a crime scene and you recovered blood, no, at the crime scene, you have to establish whether this is a blood of human or a human blood or an animal blood. No, so you should apply techniques for that. So this classification of the basis of human identification, there are two classifications: ordinary methods, no, and scientific methods. So ordinary methods of identification are those which laymen use to prove identity. No special training or skill required. So you as investigators, no, you can, you can use these ordinary methods to identify something or someone. Okay. Then the scientific methods, of course, it needs more technical knowledge and skills for that matter. Okay. So points of identification applicable to persons only or living persons only. So these are the points of identification that we can use to identify a living person. No? Okay. So pag may living, then basically meron ding dead person. No? So these are the things that you have to consider for purposes of identification. Characteristics which may easily be changed. Characteristics which may easily be changed. No? Growth of hair, yan, napapalitan yan. Okay? Bird or mustache. Of course. Pag mahaba ang buhok niya noon, ngayon, very nagpagupit na, then basically it changes the identification. Kaya sometimes pag nagpagupit yung suspect, then basically mahirapan ka to determine, no, his identity. Ganon din ang clothing, no? But mostly, no, because of CCTV today, no, by virtue of the clothing, we can establish the suspect, no? So pag may nakita kang person of interest with the same clothing, then at least you have a lead, a possible lead that this is the suspect because of the clothing. But again, these characteristics can easily be changed, no? Frequent place of visit. Yeah, frequent place of visit. Okay? So a person's special desire or habit to be in a place if he has the opportunity to do so. Yeah. So example, ang crime scene is nangyari sa isang place. Example, a place or inuman, for example. Yeah. So kung yung meron kang na-identify na mga tao na parating pumupunta doon, then you can target them as persons of interest. Yeah. Pag sinabi nating persons of interest, not really a suspect, no? But these are the people that may give necessary and significant information, no? As far as the case is concerned. But they can also be a suspect if evidence is sufficient. Okay? So also grade of profession. Mechanic may be recognized by his tools. Yan. Yan. A clergyman by his robe or a nurse by her cap. For example, does the victim mention to the investigator that the suspect is wearing a cap of a nurse or a robe, no? Then or a uniform of the police, then we can start there by building a case that possibly the suspect is a policeman, a nurse, or a clergyman. So, pag sinabing clergy, we may refer it to priest or any minister or pastor. Okay? So body ornamentations also. Earrings, necklace. Yeah. For example, for Ifugao people, they have their necklace, no? Pag yan ang na-describe ng suspect, victim or witnesses, then at least alam mo kung saan ka mag-uumpisa, no? Na possible suspects. Yeah. Body ornamentation, earrings, yeah. Necklace, rings, pins, and etc. Usually worn by the person as suspect. So these are the characteristics na pwede mong magamit in order for you to start your case as far as the identification of the suspect, no? Or identification of the suspect or victim. So when we are identifying not only the suspect but the victim, okay? So by virtue of his hair, his clothing, frequent place of visit, grade of profession, and body ornamentations, okay? Then another point of characteristics that we can use to identify a person, a living person, no, is number one, but this may not be easily changed. Hindi katulad ng clothing. Kasi ang mga body ornamentation, they can change it. Yung mga robe, yung mga tools, they can be removed. Frequent place of visit, you can also change that. Okay, so these are also the characteristics that we can use to identify someone who's living that may be a suspect, no, through that are not easily be changed. Number one is mental memory. Mental memory is a recollection of time, place, and visit. Of course, you know, uh, uh, when you tell a lie, that is against your mind, because your mind knows what is true. So when you say something that is a lie, then that is contradictory to your mind, because your memory says that this is the truth, no? And memory is difficult to change, no? So that is why there are techniques also to determine whether a person is lying or not, no? Either through observation or through scientific methods. So next characteristics is of course the speech. Yan. Sa pananalita ng tao, pwede mo ma-establish kung sino yung tao yan. Sa klase ng boses, yan, manner of talking, paano magsalita. Yan. So parang yung mga native Ifugao, for example lang, you can determine kung taga Ifugao yan o taga mountain province, and the way they speak, so we can determine the race of the person. So ganun din yan, okay? So speech, a person may stammer, stutter, or lisp, manner of talking, and quality of the voice. So yan. So we can use this in order to identify a person, okay? Another also that we can use to identify a person is through his gait, no? Sometimes they call it gait or gait, no? Gait is, in other words, known as manner of walking. So we can establish the identity of the person through his gait. Kasi ang mga tao hindi pare-parehas ang manner of walking, no? Sometimes kahit nakatalikod yan, nakikita mo pa lang yung paglalakad, you can say that is Juan or Pedro through his or her manner of walking. But you know also there are very many, there are specific types of gait. These are caused by mental abnormalities or disease. Kaya ang mga gait na ito, these are abnormal. No? So merong normal gait, but again, ang normal gait din, magkaiba-iba yan. No? Ganon din ang abnormal gait or manner of walking, magkaiba-iba din yan. So ang abnormal gait is caused by disease. No? So ito yung mga example ng abnormal manner of walking for people having diseases. No? Yeah. So, and others, but this is not limited only in this presentation. So we have spastic paresis, seen in corticospinal tract lesion in stroke. Yan. So, tignan yung spastic gait na yan, ganyan yung itsura because of stroke. Nakaganyan yung kamay. Yan, nakikita niyo yan. So pag ganyan ang manner of walking, yan, nakapilko yung isang kamay, yan, nakaganyan yung isang paa, yan ay spastic gait. Yan, okay? Yeah, this is because of stroke causing poor control of the flexor muscles during swing phase pag naglalakad yan. Okay? Then another gait is the seesaw gait. No, seesaw. So ano ang appearance nito? Ganyan. Kaya pag naglalakad, nakro-cross yung paa. No? So I hope meron kayong nakitang ganyan for you to further understand. Yeah. But these are because of abnormalities because of diseases. Yeah. Seesaw. Another is cerebellar, no, ataxia. No? This is a disease of the cerebellum-associated tracts. Gait or gait is staggering and steady and wide-based. Tignan yung paglalakad niya. Nakalos yung kamay, yan, nakaganyan, medyo sakang, no, yung tao habang naglalakad para siyang robot, no? Yan. Okay? Another is ataxic gait. Yan, ataxic. Ataxic gait. Yan yung manner of walking niya. Ganyan. No? Parang nakataas muna yung paa bago bababa, bago mag-move. Okay? Yan ang ataxic gait. Okay? Ataxia. Alright, so these are some of the examples of gait, and there are many others. Meron ding frog gait, cow's gait. Yan. So tingnan nyo kung paano maglakad ang cow. Yan, ganun ang paglalakad ng tao na yan. No? So marami. Okay, but the point here, ladies and gentlemen, is we can identify the person by virtue of his manner of walking. Yan, manner of walking. Okay? So next is mannerism. Yan. We can also identify a person through his mannerism. Yan. Mannerism is a stereotype movement or habit peculiar to an individual. So pag sinabing peculiar, unique yan. Hindi yan common sa ibang tao. So ikaw lang ang pwedeng nakakagawa niyan. So ang mannerism pwedeng sa way of sitting. Yan. Movement of hand, movement of body, movement of facial muscles, manner of leaning, and etc. So ang mannerism, baka habang nagsasalita ka, ginaganyan mo yung kamay mo, binababa mo, then every time and then that you talk, you do that. That is a mannerism. Pag iyan ay ginagawa mo in a regular course, when you are doing something, when you are talking or sitting, habang nakaupo ka, gumagalaw tiubit mo, every time and then that is a mannerism, or yung mata mo. Gumagalaw yung mata mo for that matter. Or baka yung even your nose lumalaki habang nagsasalita ka, bumabalik sa dati, then that is a mannerism. Okay? So do not forget that. Hands and feet also can be used to identify a person. Yeah. No? Sa paa pa lang, sa kamay pa lang, kahit hindi mo natignan ang mukha, then you can say the name of the person or identify him dahil sa hands and feet as to size, shape, and even abnormalities. Yan. So ang paa natin, merong size, shape, and abnormalities that we can use to establish the person. Paano kung natagpuan lang is paa? no? Meron kang hinahanap na missing person. Ang natagpuan lang is uh, hands or feet. Then, base doon sa size, shape, then you can say that, this is the foot of Pedro, this is the foot of Juan based on its size, shape, and abnormalities. Okay? So, yan. Alright? So, foot or hand impression develops when a foot or hand is pressed on moldable materials like mud, clay, cement mixture, or other semi-solid mass. Yan. Kaya na nagkakaroon ng molding. Okay? Yan. Okay? Next is complexion. So we can identify a person through his complexion. Yan. The color of the skin. Okay? Yan. So alam mo kung negro yan or eta yan or Amerikano yan because of its complexion. Okay? So, then changes in the eyes, nearsightedness, farsightedness, state of being colorblind, etc. Yan. We can also use that. Faces. Yan. So mga faces, different kinds of facial expression brought about by disease or racial influence. So, ang faces kaya meron tayong tinatawag na mongoloid face. Yan. So, base ito sa itsura ng mukha. No? Either because of race, no? Or because of disease. No? Kaya merong mga ibang tinatawag na mongoloid face. Yan. Mongoloid. Ang mongoloid is malaki yung cheekbone niya. Yan. Okay? Yan ang faces. Left or right-handedness. Yan. Okay? Pwede rin magamit yan kung left-handed or right-handed yung tao, especially yung mga left-handed. Then degree of nutrition. Yan. Of course, kung mataba yan, malaki yan, no, payat. Yan. Yan ang degree of nutrition in relation to height and age. Okay? So those are some of the common characteristics that investigators can use, no, to identify a person, and these characteristics may not be easily changed. Okay, mental memory, speech, gait, mannerism, hands and feet, complexion, changes in the eyes, faces, left or right-handedness, and degree of nutrition. Okay, so do not forget that. Next topic are the points of identification applicable to both living and dead before onset of decomposition. So another term for decomposition is putrefaction. Yan, putrefaction. So I hope you know what is decomposition. Decomposition is the stage where the body tissues starts to be destroyed through the bacteria, or the environment. Okay, so a while ago we discussed the points of identification applicable to living. Now we discuss the points of identification applicable to both living and dead before onset of decomposition. Before onset. Kasi pag na-decompose yan, nag-skeletonize na yan, hindi mo na pwedeng magamit yung points of identification ng mga ito. It should be before the onset decomposition. Okay? Yeah. So first is occupational marks. Yeah. Certain occupations may result in some characteristics marks of identifying guide. Yeah. So pag may namatay, for example, or a cadaver, natagpo ang bangkay, you can determine the identity, kung sino ba ang taong yan, kahit hindi yung pangalan, but at least you can establish, his characteristics, through his occupational mark. Kung marami siyang tattoo, then you can say that this person is basically in the venture of tattooing. Yeah. In the business of tattooing. Kung ang mga kamay is puro kalyo, then basically this person is working, in the construction or any similar things that you can identify. Another, we can also identify a person, whether living or dead, through his race. Yan. Through his race. Yan. Pag nakita mo, yan, yung color of the skin. Yan. So, when you're talking of race, we can consider the color of the skin. Yan. We can consider the feature of the face. We can consider the shape of the skull. And we can consider the wearing apparel. No? So these are the considerations when we are using race to determine a person or a dead person. Yan. So starting from the color of the skin, pag nakita mo fair yung skin niya, no? Hindi naman yan masyadong maitim, no? Hindi rin masyadong maputi. Then basically, they call the person as a Caucasian. So pag sinabing Caucasian yan, fair yung kanyang skin color. Pag brown yan, katulad ng karamihan ng mga Pilipino, Malayan ang tawag dyan. No? Pag fair din, pwedeng Mongolian din yan. Of course, pag black, pwedeng negro yan. No? But again, the term negro, is not good, no? Because the term negro has been devised, no? Because that is a term used by the white Americans, no, addressing their slaves, the black Americans, no? Yan, negro. Then, of course, on the feature of the face, yan yung faces na sinasabi ko kanina. Yan, pag prominent, sharp nose. Yan, yung kanyang nose is sharp, talagang natangos. Caucasian yan. Yan. Pag flat nose, katulad natin, with round face, then that is Malayan, no? Yan, so you check yourself. If you are a Caucasian, Malayan, a Mongolian, or a Negro. Yan. So pag almond naman yung eyes, no? Almond and prominent cheekbone. Malaki ang mata, malaki rin yung cheekbone. Yan, pwede kang humawag sa cheekbone niya, no? Then Mongolian, kaya tinatawag natin Mongoloid face. Yan. Then Negro, if you have thick lips, so yung may mga thick lips dyan, and prominent eyes, they are considered Negro. Okay? Then shape of the skull, yan, so skull naman yan. Okay? I hope you know where is your skull. So pag elongated yung skull, you are a Caucasian. Round head apparel, you are a Malayan. Round head, Mongolian. Red Indians and Eskimos, they have flat heads. Okay? Flat heads. Especially sa likod. Yeah? Hindi naman sa taas ang flat. Okay? Then wearing apparel also can be used to identify based on race. Yeah. Sabi ko nga yung mga Ifugao or any ethnic groups in Cordillera, no, they have identifying wearing apparels that may identify the race. So casual and customary wearing may indicate race as well as religion, nationality, region, and custom. Yan. So pag nakita mo yung victim, for example, or suspect, meron siyang suot ng mga Muslim, yung pang-cover nila, or yung suot sa ulo, their cap, na ganun sa mga Muslim, then basically you can say that the suspect or the victim is, his religion is Islam, no? Or they are commonly known as Muslim people. Okay? And others, no? Pwede mo ring masabi na Ifugao yan or Cordilleran yan, kung yung kanyang ribs is red. Yan, kasi agmamama, then basically you can say that the suspect or the victim is an Ifugao or a Cordilleran in general. Okay? Yan, so race can be used to identify a person, whether living or dead. Then also we can use stature. Yan. Stature sa kanyang katawan, sa itsura ng katawan, we can establish the identity of the person. Yan. So, stature, change in height, rate of growth. Yan. So, katawan yan sa malaki yan. No? Yan. Description of a body, stature. Okay, then also we can use tattoo marks. Yan, tattoo marks. Alam niyo naman, ang tattoo marks can give you identification for that. Okay? Yan. Tattoo marks, dalawa lang yan. No? May mga tao na they have their tattoo marks. Example, in Kalinga in the early times, no? They have to put their tattoo. Sa ngayon, ginagawang tattoo as an art. Yan. Noon din, ang tattoo is, pag meron kang tattoo, you are an ex-convict, okay, or from prison. But that is not absolute. It depends, okay? But ang mga tattoo din, pwedeng nakasulat dyan pangalan ng tao. Pwede mong ma-identify yung tao kasi meron kang nabasa doon na Juan na nakasulat sa katawan niya, na tattoo niya, then you can say that pwedeng possible ang pangalan niya is Juan because yung nakasulat sa katawan niya. Okay? Yan, pag cadaver yan, pag hindi nagsasalita yan kasi patay nga. Okay? Yan. And weight also can be used, not a good point of identification, ang weight. Yan. Because it can change from time to time. Ganun din naman ang stature. It can change. Okay? From payat to mataba to malaki. And deformities also can be used. Yan, deformities. Pwedeng congenital or acquired. Ang congenital, pwedeng inborn yan. No? Panganak mo, meron ka ng deformities sa anumang parte ng katawan mo, then we can use that as identification mark. Or pwedeng acquired because of accident or any similar situation. Okay? Birthmarks also. Yes, magkaiba naman ang deformities sa birthmarks, no? So, ang birthmarks, yan ay inborn upon birth. Yan, pwede may red marks ka doon sa ulo mo, sa likod mo. Yan, kaya pag bangkay ang natagpuan, may missing person, may natagpuan, base pa lang sa birthmark niya, you can say that this is the person. Okay? Yan. Injuries leaving permanent results. Yan. Injuries leaving permanent results. For example, natagpuan ang bangkay is meron siyang amputation na 3. Putol yung kanyang daliri kasi yan ay talagang naputol when he was living. No? Yan. Pwede mong magamit yan to identify the person. No? Yan. And then moles also. Alam nyo naman ang moles. No? Pag hindi mo pa alam yan, i-research mo. Yan, yung mga black-black na yan na tumutubo sa katawan, yan, pwede natin magamit yan. No? Pag meron kang dalawang moles sa likod mo, then you can use that to identify the person. You know, commonly ito, you can use this if the person is dead or a cadaver. Alam nyo, ang term na cadaver or corpse is used when there is a discovered dead body and the identity is not established or cannot be established. So pag hindi mo alam ang identity ng tao na natagpo ang patay, then the term used is cadaver or corpse. Yan. So scar also can be used to identify a person. And I hope you know what is scar. Yan. Okay, a remaining mark after healing of the wound. Yan. So, ang age of scar, pwedeng recently formed, yan, or few weeks or 2 months, 2 to 6 months, or 6 months or more. So, may age din yan. Okay? Another technique to describe or identify a person is through portrait parle. Other term for portrait parle is a spoken picture. Because ang ginagawa dito, there is a verbal, accurate, and picturesque description of the person identified. Such information will be given by the witness, relatives, or persons who have acquainted with the physical feature. Ang portrait parle is when you are describing No, the suspect or the relatives or witness is to describing the physical appearance, the appearance of his face. No, you are describing it to the investigator. Then what you are doing is a spoken picture, and the Latin for that is portrait parle. Okay. Okay, so those are the ordinary methods, the common ordinary methods that can be used to identify a person, whether living or dead. Okay? Pero ang common dyan is pag dead. Kasi pag namatay yung tao, as far as investigation, criminal investigation is concerned, hindi yan nagsasalita. So through these points of characteristics, we can identify the person. Okay? Because identity is very important. No? Just remember, if you have no name, no, pag walang pangalan ang tao, no, pare-parehas ang mukha natin, then we could not identify one another. Okay? So, itong second method of identification is the so-called scientific method of identification. Hindi na ito ordinary. So, this is the opposite of ordinary methods. Okay? So these scientific methods, of course, it is called scientific because it is based on science, no, technology, no, and technical skills for you to accomplish this, no. Hindi kung sino-sino, hindi even the investigator will not even do this, no, but for experts. So of course, in fingerprinting, I will leave it to you. No, the science is fingerprinting. It is not fingerprint. So fingerprint is not a science, but fingerprinting or dactyloscopy, dactylography, poroscopy, and so forth, allied sciences. So you have a separate subject for that. So I leave it to you. Okay. And fingerprint is the most reliable means of personal identification. Dental identification also is one of a science that is very important in identification of persons. So we have many kinds of regarding dental identification. We have forensic odontology. Yan. Forensic odontology. Forensic odontology is a specialty of dentistry. Yan. So pag sinabi mong dental, ang ginagamit dito to identify a person is the teeth, yung kanyang teeth. Yeah? Ang teeth is walang S yan kahit plural or singular. Okay? Yan. So, forensic odontology is a branch of forensic medicine and in the interest of justice deals with the proper examination, handling, and presentation of dental evidence in court. The work of a forensic odontologist covers the following: identification of unknown human remains through dental records. Yan. Alam nyo, pag na-skeletonize ng tao, nabulok na at skeleton na ang natitira, hindi mo na makikita ang tattoo marks, birthmarks, scars. No? So, ang natitira is yung buto or bones and the teeth. Kasi ang teeth, hindi yan basta nabubulok because the teeth have its enamel. Yung enamel is the hardest substance of the human body. Pwedeng mabulok yung buto mo, no? Pero yung teeth mo, andyan pa rin. No? So identification of unknown human remains through dental records and assisting the scene of a mass disaster. Yan. So pag may mass disaster yan, matagal bago matagpuan ang mga taong involved na namatay. Age estimation of both living and deceased. So pag sinabing deceased, no, dead, including neonatal remains. Yan yung mga fetus or yung mga namatay na sa womb of the mother. Analysis of bite marks found on victims of attack, no? Function yan ng odontologist. Identification of bite marks in other substances such as wood, leather, and foodstuffs. Analysis of weapon marks using the principles of bite mark analysis. Presentation of bite and weapon mark evidence in court as an expert witness. Assistance in building up a picture of lifestyle and diet of an archaeological site. Okay, so unidentified bodies come to light frequently having drowned, burned, murdered, having committed suicide, yan, pwedeng magamit ang forensic odontology. So, ang involved, ngipin. Yan. Despite recent advances in DNA technology, dental identification is still offers a rapid and cost-effective approach for human remain. Cost-effective kasi hindi yan masyadong mahal compared sa DNA. DNA is mahal yan. The most expensive one. No? Okay? So do not forget that. Yeah. Why are teeth a good source of DNA? Yeah. Magkaiba ang DNA sa DNA analysis. Ang DNA, yan yung ina-extract para magkaroon ng DNA analysis. Not only are teeth, not only are teeth often the only source of DNA available. In fragmented remains, but also their unique composition and location provides added protection to DNA. Yan. Kaya ang buto kasi, ang buto or bones, pag tumagal yan, no, nasisira din yan. Ang loob niya is nasisira din yan pag tumagal ng tumagal. Pero ang teeth, as I said a while ago, it has a protective, it has a protection. So yung andun sa loob ng teeth natin is protected by enamel. That is the hardest substance of the body. Kaya magandang pagkunan yan ng DNA sample for purposes of DNA analysis. Okay? So ganun ka-important yan. Kaya pag investigator ka, hindi mo alam itong medico-legal techniques na pwede palang magamit ang teeth, then hindi mo yan bibigyang pansin. Pero pag alam mo that teeth can be used to identify a person for purposes of any investigation, then you will preserve it. No? Then request for a forensic odontologist to conduct such examination and analysis. Okay? So bite mark analysis yan, is a subspecialty of forensic odontology that focuses on the identifying of perpetrators by comparing dental records to a bite mark left on the victim or at the scene. Yan. Pag bite mark, I hope you know that. Parang footprint din yan. Okay? There are 4 main types of teeth. Yan. So alamin natin, no, for us to be updated, no, kung ano ba yung about teeth. No, we have our teeth, but sometimes we do not know their names also. So the 4 main types of teeth is we have incisors. Yan. Kaya tinawag na incisor kasi yan yung tagakat, yan yung nasa harap natin. Na flat. Incisor yan. 4 ang incisor natin. Okay? Then canines. Yan yung pointed. Para kang vampira. Canine yan. No? Mostly 4 din ang canine natin. Upper and lower. Then premolars. Ayan, premolars. Okay? Then molars. So 4 din. So incisors, canines, premolars, and molars. So pag investigator kayo, should know these terms. So that pag gumawa ka ng report, then you should know the proper term. Is this a canine? Is this a premolar? Is this a molar? Or is this an incisor? Teeth. Okay? Alright? So the largest teeth is the molar. Yan yung pinakahuli nandito. Yan. Malapit sa wisdom tooth. No? Molar. Types of teeth naman is yan. Okay? Yan, ito yung mga picture niya. Okay? Yan yung incisor, canine, yan. Premolar, yan yung medyo mas maliit. Yan din molar, that is the largest. Okay? Then meron ding main parts of the tooth or pag-isa tooth. Yan. So enamel, ito yung covering part. Kaya pag yan, that is the hardest part of the harder substance. Yan. The hardest substance of the human body. It's the enamel of the teeth. Okay? Yan. Okay, sa loob niyan, yung dentin, the pulp, yan. Of course, ito yung bones sa may jaw natin. gums. Yan. Okay? Kaya yan. Sabi natin kanina, magandang pakunan yan ng DNA kasi protected yung nasa loob at hindi yan basta nasisira o na-alter. Okay? Another. Yan. Enamel. Itong size na yan, papunta doon sa baba. That is the crown. Yan. Enamel, that is the covering. Dentin, yan. After the enamel. Yan. Kaya pag wala ka ng enamel, nasira na yan. Yan. No, is it a threat? Yan. Okay? And that is the root. Alright? Then another is the surfaces of a tooth. Yan. Surfaces. Mostly applicable yan dito sa molar na ngipin. Yeah? So, yan yung front of your mouth. Parang nakaside ka. Yan. So, dito, front of your mouth, going that direction. Yan. Paside yan. Okay? So, dito malapit sa iyong dila is the lingual. Opposite is the facial. Yung center is the occlusal. And distal, yan. Distance between the, papunta doon sa loob. Then, ito is palabas yan, malapit sa iyong mouth is the mesial. And so, mesial, distal, facial, occlusal, and lingual. Okay? Then, classification of human teeth. So, you should know this one. Okay? Yan. So, ito yung ngipin, normal teeth. Ang tao, meron siyang 32 normal teeth. Yan. Normally, ang tao is merong 32 teeth. Okay? 32. So, let us divide them into 4. Upper right, upper left, lower right, lower left. So, sa upper, ito ang counting niya. Mag-start ka sa upper right. Yan. So, sa upper right, start mo ang numbering 1, 2, 3, 4, 5, 6, 7, papunta sa upper left, 16. So, sa upper right and upper left, merong 16. Sa baba, meron din 16. So, to have a total of 32 teeth. Kung meron kang 20 dyan, di kasalanan mo yan. Nangangarot kung 20. No? So, ito yung counting niya. No? Ang counting is start with the upper right, third molar. Ito, nakikita niyo yung arrow. That is the wisdom tooth. Number 2 is second molar. That is, nabubuo yan. Yan. Then, upper right, number 3. Yan. Third tooth is the first molar. Ito. First molar ito. Fourth one, it is the second bicuspid or the second premolar. Yung bicuspid, other term for premolar. Yeah. Number 5 is the first bicuspid. That is the first premolar. Yeah. Then number 6 tooth is the cuspid. That is the canine tooth. Yeah. Number 6, canine. Number 7, that is the lateral incisor. Lateral incisor. Yan. So, dalawa ang klase ng incisor. Lateral and central incisor. Okay? Lateral and central incisor. Okay? So, number 7 is lateral, upper right. Then, number 8 is central incisor, number 8. Number 9, no? Number 9 is upper left. So, ang upper right is tooth number 1 to 8. Ang upper left starts from tooth number 9 to 16. Ang lower right starts with, left, I should say, starts with number 17. Then, lower right starts with number 25. 25, okay? So, let's go back to the upper left. So, in number 9, tooth number 9, the name of that is upper left central incisor. Number 10, the name of that is upper left lateral incisor. Number 11, upper left cuspid or canine tooth or canine. Number 12, that is upper left, first premolar or first bicuspid. Yan. Yan, ito ang itsura ng cuspid yan. Cuspid, then bicuspid. Yan, yan. Okay? Yan, so that alam nyo. Okay? Meron din dyang molar. Yan, alam nyo naman na meron sa taas. Okay? So yan cuspid, bicuspid. So ang cuspid is canine. Yan. Number 11 is canine, that is the cuspid. Okay? Or canine tooth. Yan. Yan. Then number 12 is, tooth number 12 is upper left first bicuspid. Yan yung bicuspid niya. Yan ang spelling niya. Yan, cuspid yung isa. Yan ang canine. Then 13, tooth is upper left. So pag sasagot kayo in quizzes, kailangang i-indicate ninyo kung upper left yan, or upper right, lower right, or lower left. Okay? So do not forget that. Okay? So number 14, that is first molar. Okay? Number 15, that is second molar. Number 16, that is third molar. Okay, so let us proceed to tooth number 17. Lower left, third molar. 18, second molar. 19, tooth number 19, lower left, first molar. Number 20, that is tooth or lower left, second bicuspid. 21, that is lower left cuspid or first bicuspid. Number 21, first bicuspid. 22, that is cuspid or canine. Number 23, that is lower left lateral incisor. 24, that is central. So central incisor. Okay. Yan yung spelling. Let me just write here. Central incisor and lateral. Yan ang incisor. Yan yung incisor. Yan yung dalawang incisors, central and lateral incisors. Okay? Okay? Then number 24, that is central, lower left central incisor. Then that's the end of the lower left. So from 17 to 24. Then lower right. Lower right starts with number 25, tooth. Tooth number 25 is central incisor. Tooth number 26 is lateral incisor. Tooth number 27 is cuspid or canine. Tooth number 28 here is first bicuspid, or first premolar. Then 29 is lower right, second premolar. Then 30 is first molar. 31 is second molar. Then 32, the last teeth or tooth is the lower right, third molar. So if I will ask you how many molars that we have, there are three kinds: first, second, and third molar. Ang third molar, yan yung wisdom tooth. Okay? How many kinds of incisor? There are two, central and lateral. Ang canine, isa lang yan, isang klase yan. Okay? Ang premolar, dalawa rin yan, first and second premolar. Okay? So please memorize this. So that pag meron kang natagpuan na ngipin, pag gumawa ka ng spot report mo, or reports mo, investigative reports, then you should know the proper name for those teeth or tooth, no? Then it has been numbered like that. So in your quizzes, if I will ask your name, tooth number 15, yeah, tooth number 11, tooth number 31, then you should say the complete descriptions. Example, name, tooth number 12. Then what will be your answer? Upper left, first bicuspid, or first premolar. That is how to answer. Complete it using this upper right, upper left, or lower right. Okay? So if I will ask you saan nag-uumpisa ang bilang ng mga teeth, nag-uumpisa yan sa upper right. Okay? And what is the first teeth or tooth? It is the third upper right, third molar. So always complete it. Okay? So yan ang numbering. So that is all about forensic odontology. Next is handwriting. Of course, you have your question document examination as a subject. I leave it there. Okay? Okay? I will leave it there. All right? So, handwriting, but of course, another additional terms is the term bibliotics, graphology, handwriting, and writing. Bibliotic, the science of handwriting analysis. Graphology is a study of handwriting for the purpose of determining the personality, character, and aptitude of the person. Yan. Pag pangit yung sulat mo, pwedeng sabihin na pangit ang ugali mo. Yan. Yan ginagawa yan ng graphology. Pero pag ang ina-analyze is handwriting, no, is bibliotics. Yan. Okay? So you have your subject question document. So I leave it for you to understand that in the future pag hindi niya pa natapos. Yan. So ang handwriting kasi, pwede mong magamit yan kasi walang taong parehas ang handwriting. No? Lahat tayo, we have our own unique characteristics kung paano magsulat at hindi mo pwedeng gayahin yan. Or else that is forgery. Okay? So that is handwriting. No? Diyan papasok ang forensic document examination or handwriting examination. Then identification of the skeleton. So we can use the skeleton. So kahit ina-skeletonize na yung victim o meron kang natagpuang skeleton, then pwede pa rin magamit yung skeleton to identify the suspect or to identify the victim. Okay? So with the use of forensic anthropology. Yeah, anthropology in the anthropometry. So forensic anthropology is a special subfield of physical anthropology. Yeah, study of human remains. Yeah, so ang human remains natin is of course our skeleton or the bones. Okay? Okay, so kinukuha yan, nile-layout yan, ina-examine yan. Pwede rin pumasok ang DNA dyan. Okay? So forensic anthropologists is specialized in analyzing hard tissues such as bones. Okay? Then, in the examination of bones, the following points can be determined. Whether the remains are human origin or not. Ano ang ina-examine kung ito ay human or not. Baka ang animal yan o hindi. Study the shape, the size, and general nature of the remains, especially the skull. Whether the remains belong to a single person or not, any plurality, excess of the bones after complete layout. So, linelayout yan. Pag may sobra, then hindi sa kanya yan. Okay? Kasi pag maraming tao, marami kang nakuhang bones, then pwedeng possible 2, 3 yan. Kaya para makita mo kung ilang tao ang involved, i-layout mo. So, linelayout yan. Kinukompleto yung head, yung skull, and until the complete bones. Then height also. can be determined with the use of skeleton. Sex also can be determined. So, paano i-determine ang sex? Anong bone ang ina-examine to establish the sex of this remains? No? The pelvis, yan, skull, sternum, femur, and humerus. Yan, pwedeng gamitin yan para ma-establish yung sex. Race also can be established. Age, length of internment or length from the time of death, presence or absence of ante or post-mortem injuries. Kasi ang example yung skull, pwedeng merong butas yan, then pwedeng sabihin na there is an injury, pwedeng nabaril at ang pinatay nito, ang kinamatay is, ang manner of death is because of a gunshot wound. Congenital deformities also, yeah. Okay, and acquired injuries of heart tissues. So for us to have a view of the skeleton or bones of a person, yeah, okay. This is a bone of a human foot. Yeah. Yeah. So yan ang pangalan ng mga bones, calcaneus. Yan. Pakikita nyo na lang for purposes of yan, calcaneus yan, that is the heel bone. Talus, that is the ankle bone. Transverse tarsal joints, navicular bone, cuboid, lateral cuneiform bone, tarso-metatarsal, yan, tarso-metatarsal joint, yan, intermediate cuneiform bone, then medial cuneiform bone. Yan. Napunta na doon sa malapit sa toes, metatarsal. Yan. Yan. Phalanges ang tawag diyan, yung mga parang fingers ng paa mo, yung mga toes, those are phalanges, toe bones. Yan. Proximal phalanges, yan. Middle phalanges, yan. And distal phalanges, yung pinaka bordong niya. Okay? So that is the bones of the human foot. Then another is the bones of human hands. Yan yung mga pangalan niya. That is the lunate. So pag quizzes ninyo, you will just point that out and you identify what is that. That is the trichotrum, lunate. Yeah, para pag investigator ka, at least you have knowledge about it and use the proper term. Yan, the hamate, the pisiform, capitate, trapezoid, trapezium, metacarpal bones, proximal phalanges. Yan, sa mga fingers na to, sesamoid bone, distal phalanges. Diba sa fingerprint niya, merong phalanges yan. No? Okay, and middle phalanges. Okay? Bones of the human forearm. Yan. So, dapat alam niyo ang forearm ninyo. Yan. Bones of the human forearm. Yan. So, yung radius and ulna. Yan. Kasi dalawa yan eh. Yan. Okay? Forearm. Alright. So, yan. Olectron process. Coronoid process. Radius, ulna. Yan. Yung mas malaki is radius. Yung mas maliit, ulna. Okay? Not forget that. Yan. Yeah. Okay? Then, human femur. Yan. Yan. This is the thigh bone. Sa paa naman yan. Okay? Femur. And that is the head of the femur. The neck. The greater trochanter. Yan. That is the epiphyseal lines. Lesser trochanter. Yan. The shaft. Yan. Okay? Yan yung femur. Malaking buto. Malaking buto yan. Okay, then bones of the shoulder. Yan. Yan yung coracoid process. Yan. Acronium, anatomical neck, clavicle. Yan yung clavicle or collarbone. Yan. Glenoid cavity, scapula. Ayan, yung nandito sa likod natin is scapula yan. Ayan, shoulder blade. Okay? So, pakikita na lang yan. Mga parts. Okay? Lateral episonoid or epicondyle, radial fossa. Pakikita na lang yan. Then bones of the human thorax. Yeah, dito naman. Okay? Sternum. Ito. Clavicle ang mga yan. Yan yung bones sa shoulder. Yan. Scapula. Andiyan, kasali dyan. Okay? Ito, that is the angle, the body, yan. Xiphoid process, costal cartilage. Yan. Yan ang floating bones or floating ribs. Itong mga yan. So, ribs ang tawag dyan. 7, 8, 9, 10, these are ribs. Yan. Okay? Mga ribs na yan. Okay? It is a human rib cage. Then naman sa skull, the lateral and the frontal view. Yan, the human skull. Yan. So, tawag dito is frontal bone, sphenoid bone, dito, cranial structure, yung mga yan yan. Parietal bone dito, yan, buo yan. Occipital bone, yung nasa likod, that is the occipital bone, so that alam niyo. Temporal bone, itong hole na yan, that is external acoustic meatus, mandible, yan yung nandito, yung panga. Mandible ang tawag dyan. Yung bone dito, no? Yan. Yan. Ramos. Coronoid process. Ayan. Mental foramen. Mental foramen. Yan. Dito sa panga, no? Zygomatic bone. Yan. Maxilla. Yan. Okay? So, yan, nasal bone, yung ilong natin, nasal bone yan. Alright? So, at least you have something to say about bones. Yan. Para hindi lang butong, alam niyo, but bones, maraming names yan. Mandible, yan. Okay? Alright? Then, sa kabuuan, yan, makikita niyo yung skeleton. Okay? Alright. So that is all about the use of bones for purposes of identification. The next is the use of or the determination of sex. Yeah. So what is the legal importance of sex determination? As an aid in the identification, habit, social life, physical features. Importante bang ma-determine ang sex or gender? Of course. Yeah. To determine whether an individual can exercise certain obligations vested by law to one sex only. Yeah. Marriage or the union of a man and a woman, any male of the age of 16 or more, and any male of the age of 14 or more not under any of the impediment mentioned may contract marriage. Yeah. So, alam nyo, sa marriage, babae at lalaki lang ang pwedeng bigyan ng permiso ng gobyerno. Okay? Then there are certain crimes wherein a specific sex can only be the offender or the victim. Okay? Yeah. Pero sa rape, pwedeng lalaki, babae ng victim. Okay? Alright? Okay, so in rape cases, yeah. Okay, so anong mga crimes na babae lang ang so sex is very important to determine, no? Because of the following. Just imagine, no? Ano yung mga bagay-bagay na kailangan mong establish kung lalaki or babae yung tao. Yeah. Okay? Kasi example, hindi mo naman pwedeng sabihin na ikaw ay mother kung ang sex mo is male. Hindi mo rin pwedeng sabihin na ikaw ay father kung ang sex mo is female. So this is all about obligations. Yeah. Established by law. Hindi ka rin pwedeng mag-asawa ng lalaki kung lalaki ka. That is the standing law. No? Masakit man sa iba, but it is law. Jura lex sed lex. So, As far as today, ang pwede mo lang ikasal ng gobyerno is lalaki and babae as far as the Philippine law is concerned. Okay? Meron ding mga trabaho na babae lang or lalaki. Okay? Alright? Then, in adultery, the offender is a married woman, and concubinage, the offender is a husband. So, hindi mo pwedeng kasuhan ng adultery ang isang lalaki kasi yan ay crime lamang para sa mga babae committed by a woman. So, sex is very important to determine. Okay? So, there are tests to determine the sex. Number one, social test. Yan. Differences in social role of sexes. Dress, hairstyle, general body shapes. So, base doon, sa hairstyle, sa pananamit, pwede mong sabihin na babae at lalaki ang isang tao. No? Yung isa naman is genital test. Yan. The presence of penis, genital. Yung isa gonadal. Yung isa genital. So, the presence of penis indicates that you are a boy, and the absence and its absence and the presence of vaginal opening, indicates that you are a female. We may look for the testes in the scrotum, and if they are absent, we must not conclude that the individual is not a male. They may be in the abdomen or inguinal canal undescended. Yan, baka nakatago lang yan. Okay? Ito namang isa is gonadal test. The presence of testes in male and ovary in female. Yan, ang gonads. Okay? No, ang gonads ng lalaki, testes. Ano ang genital ng lalaki? Penis. Babae, vaginal opening. Yan, ang gonads ng babae naman is ovary. Okay? So, pag meron yung mga yan, babae at lalaki ka, respectively. Meron din chromosomal test. Yan, that is a chromosomal test. Pakibasa na lang yan. Okay? Alright? Problems in sex determination. Yan. Yan. Problema. Hindi mo alam kung ano ba talagang totoo, lalaki ba o lalaki because of these abnormalities. Yan. Example, for a person that sex organs like testes or ovaries have never developed. Yan. That is called gonadal agenesis. So, mahirapan ka kung babae o lalaki yan. Ito namang isa is true hermaphrodism, a state of bisexuality. The gonads of both sexes are present, which may be separated or combined as ovotestis. Yan. So, paano kung yung taong yan is meron siyang testes, meron pa siyang ovaries, then that is 2 in 1. And we call that as true hermaphrodism. Okay? So, I will end my discussion on that, and there are other discussions here. We will discuss that in the next presentation. So, for the meantime, let us summarize our discussion. We discussed, we ended in the determination of sex, in particular, test to determine sex and problems in sex determination. We will continue the discussion later. Okay? So again, do not forget our discussion in in the methods of identification. Okay? So with that, okay, so once again, to summarize the discussion in this session, we discussed the methods of identification, especially the 2 methods of identification. We have ordinary methods and scientific methods. We discussed the ordinary methods of identification. We discussed the characteristics, or points of characteristics. That these characteristics are those characteristics that may usually change, and those that characteristics that may not change, applicable to living and also applicable to both living and death. And with another discussion is on the scientific methods. These methods we discussed, I introduced to you fingerprint, uh, dental identification, forensic odontology, handwriting examination, question document examination. Uh, and we ended the discussion in the determination of sex. And later, in the next discussion, we will continue the discussion on the determination of sex in connection to identification. Okay. So again, do not forget to appreciate and understand the purpose of these methods of identification as part of the medical legal considerations when dealing with the investigation of crimes. Okay, so with that, have time to look into this simple discussion and be guided accordingly. Be safe always. Thank you. God bless.